Hello and namaste. This is Abhishek. Welcome to my YouTube channel. We have been discussing on various topics that are usually asked on USMLE Step 2, Step 3 and other board exams. We have been covering a lot of topics on preventive medicine, and the last topic we have covered was adult immunization. It was the first part. Today we are going to discuss further on adult immunization. These recommendations have been taken from the Advisory Committee on Immunization Practices. They are available on the CDC website. So today we'll be discussing on pneumococcal vaccine, hepatitis A vaccine, hepatitis B vaccine, meningococcal, COVID-19 and MMR vaccine in adults. Coming to pneumococcal vaccination, the candidates are persons of age 65 years or older, or the persons of age 19 to 64 years with certain underlying medical conditions or other risk factors for pneumococcal infection. These risk factors are like underlying chronic medical conditions such as chronic heart disease, chronic lung disease, chronic renal disease, persons with history of cigarette smoking, persons who have history of cochlear implants. These patients are increased risk of pneumococcal infection. Similarly, history of congenital or acquired asplenia, CSF leak, persons with diabetes, generalized malignancy, HIV infection, Hodgkin's disease, other immunodeficiency or immunosuppressive disorders. Similarly, hematological malignancies like leukemia, lymphoma, myeloma, also nephrotic syndrome, transplant patients undergoing immunosuppressions, sickle cell disease and other hemoglobinopathies. Those patients who are unvaccinated or who have unknown status of vaccination, they are usually given two vaccines. The first one is PCV15, which is followed by PPSP23 after 1 year. Or there is a separate vaccine, that is PCV20. If it is given, then one dose is enough. If the patient is previously vaccinated with PCV13 or PPSP23, either of them, then we'll use the other vaccine. That means if the patient is vaccinated with PCV13, then we'll use PPSP23. Or if the patient is previously vaccinated with PPSP23, then we'll use PCV15. Or we'll use PCV20 as a single dose after 1 year of injection of those vaccines. If the patient have received both vaccine, then a repeat of 1 dose of PCV20 or PPSP23 at more than or equal to 5 years after the last dose is given. The minimum interval of 8 weeks between the two vaccines, that is PCV13 followed by PPSP23, can be considered in adults with an immunocompromising conditions, cochlear implants or CSF leak, so as to rapidly prevent pneumococcal meningitis infection. Coming to hepatitis A vaccination, there are special candidates who need to be vaccinated with hepatitis A vaccine. They are the persons with chronic liver disease of any etiology, persons with HIV infection, men who have sex with men, injection drug users, persons experiencing homelessness, persons with hepatitis A virus exposure in research laboratories or non-human primates with hepatitis A virus infection. Similarly, persons traveling to countries with high or intermediate endemic hepatitis A, persons who are close personal contact with international adoptee like household or a regular babysitting in first 60 days after arrival from the country with high or intermediate endemic hepatitis A, pregnancy if at risk for infection or severe outcome from infection during pregnancy, or settings for exposures including healthcare settings targeting services to injection or non-injection drug users or group homes and non-residential daycare facilities for developmentally disabled persons. The vaccine is 2-dose series Hep A, that is Havrix 6 to 12 months apart, or Vacta 6 to 18 months apart, the minimum interval between the doses being 6 months. Or 3-dose series of Hep A, Hep B, that is Twinrix at 0, 1 or 6 months. Coming to hepatitis B virus vaccine, persons of age 19 through 59 years will give them a complete 2 or 3 or 4 dose series of vaccine, the 2 dose being Hepatitis B at least 4 weeks apart, the 3 dose series being Ngrex pre-Hervibro or Recombivax HB at 0, 1 or 6 months, or 3 dose series of Hep A, Hep B, that is Twinrix at 0, 1 or 6 months, or 4 dose series, that is Hep A, Hep B, Twinrix accelerated schedule of 3 doses at 0, 7 and 21 to 30 days, followed by a booster dose at 12 months. Persons who are at age 60 years or older with known risk factors for hepatitis B virus infection should completely be given a hepatitis B vaccine series. Those persons who are on dialysis, they should complete a 3 or 4 dose series, and the dose is different in these persons. Will use the 3 dose series Recombivax HB at 0, 1 and 6 months with dialysis formulation. Similarly, the 4 dose series, that is Ngrex B at 0, 1, 2 and 6 months, will use double the dose that is usually given in normal adults. We have talked about giving vaccine to those persons who are increased risk of hepatitis B virus infection in age 60 years or older. Those risk factors includes chronic liver disease of any etiology, that may be hepatitis infection or cirrhosis, fatty liver disease, alcoholic liver disease and so forth. Persons with HIV infection, persons with sexual exposure risks like sex partners of hepatitis B surface antigen positive persons, sexually active persons not in mutually monogamous relationships and so forth, current or recent injection drug users, percutaneous or mucosal risk for exposure to blood like household contact of hepatitis surface antigen positive person, residents and staffs of facilities for developmentally disabled persons, healthcare and public safety personnel, persons on maintenance dialysis, etc. Other risk factors are incarceration and travel to countries with high or intermediate endemic hepatitis B. Coming to meningococcal vaccination. There are 2 types of vaccine for meningococcal vaccination. The first vaccine is MenACWY, which comes with a brand of Menectra, Menevo or Menquadfi. The candidates for MenACWY are persons with anatomical or functional asplenia including sickle cell disease, HIV infection, persistent complement component deficiency, complement inhibitors use. They are usually given 2 dose series at least 8 weeks apart and revaccinated every 5 years if the risk remains. Similarly, persons traveling in countries with hyperendemic or epidemic meningococcal disease or microbiologists routinely exposed to Neisseria meningitidis, they are given with 1 dose of MenACWY and revaccinated every 5 years if the risk still remains. And similarly, the first year college students who live in residential housing if not previously vaccinated at age 16 years or older, or military recruits who live in the residential housings, they are usually given 1 dose of MenACWY. MenB vaccine is also another vaccine that is given to candidates who are susceptible to meningococcal infection. These candidates include those persons who have anatomical or functional asplenia, including sickle cell disease, persistent complement component deficiency, complement inhibitors use like eculizumab or ravulizumab, or microbiologists routinely exposed to Neisseria meningitidis. They are given with either 2 dose primary series or 3 dose primary series. The 2 dose primary series are given at least 1 month apart, or the 3 dose primary series are given at 0, 1 to 2 and 6 months. Then they are given with 1 dose of booster at 1 year after primary series and then re-vaccinated every 2 to 3 years if risk remains. In case of pregnancy, MenB is usually delayed until after pregnancy unless at increased risk and vaccination benefits outweighs the potential risk for complications. Also, adolescents and young adults at age 16 to 23 years not at increased risk for meningococcal infection, they are usually given this MenB vaccine based on shared clinical decision making. Coming to Hemophilus influenza type B vaccine, the candidates are those persons with anatomical or functional asplenia including sickle cell disease or persons with hematopoietic stem cell transplant. Persons with anatomical or functional asplenia are given 1 dose if previously they have not received the Hemophilus influenza B vaccine. If elective splenectomy is planned, then one dose, preferably at least 14 days before splenectomy, is given. Persons with hematopoietic stem cell transplant, they are given 3-dose series 4 weeks apart, starting 6 to 12 months after successful transplant, regardless of Hemophilus influenza B vaccination history. Coming to COVID-19 vaccination. The candidates are all adults, that is routine vaccination. The vaccine and schedules are primary, that is 2-dose series at 0 and 4 to 8 weeks, especially Moderna vaccine, or 2-dose series at 0 and 3 to 8 weeks, that is Novavax or Pfizer Biotech vaccine. In cases of persons who are moderately or severely immunocompromised, we give 3-dose series of Moderna, that is 0, 4 and 8 weeks, or 3-dose series of 0, 3 and 7 weeks of Pfizer Biotech, and 2-dose series at 0 and 3 weeks of Novavax. Coming to MMR vaccination, the routine vaccination is given in cases where they have no evidence of immunity to measles, mumps, or rubella, and the dose is a single-dose vaccine. The evidence of immunity is determined by following criteria, like born before 1957 inside US, documentation of receipt of MMR vaccine, laboratory evidence of immunity or disease. In case of pregnancy with no evidence of immunity to rubella, MMR is usually contraindicated during pregnancy as it is a live vaccine. So after pregnancy and before discharge from the healthcare facility, 1 dose is given to the pregnant patients. In patients with HIV infection with CD4 percentage more than 15% and CD4 count more than or equal to 200 cells per mm³ for at least 6 months and no evidence of immunity to measles, mumps, or rubella, a 2-dose series at least 4 weeks apart is given. However, MMR is contraindicated for HIV infection with CD4 percentage less than 15% or CD4 count less than 200 cells per mm³. In case of severe immunocompromising conditions who have no evidence of immunity to rubella, MMR is contraindicated. Similarly, in students in post-secondary educational institution, international travelers, and household or close personal contact of immunocompromised persons with no evidence of immunity to measles, mumps, or rubella, they are also given with 2-dose series at least 4 weeks apart if previously did not receive any dose of MMR, or 1 dose if previously received 1 dose of MMR. In cases of healthcare personnel, a 2-dose series at least 4 weeks apart for protection against measles or mumps, or at least 1 dose for protection against rubella is considered. And this is considered even in person born before 1957 who are non-immune. That's all for vaccination. So far we have covered on screening and vaccination in cases of adults in preventive medicine. We'll come up with further interesting topics that are usually asked in board exams of USMLE, COMLEX, and furthermore. Till then, have a great time. Thank you.